Good morning everyone and welcome. I'm Councillor Matthew Willington, Cabinet for Health, Wellbeing and Social Care. Just do some housekeeping to start with. If the continuous fire alarm sounds, please evacuate the room, public gallery, or in this case, Fiona. By the stairwells, do not attempt to use the lifts. Assemble at the Queen Victoria statue in front of the civic offices. In order to comply with the Portsmouth Cultural Trust fire marshal regulations, please remember to sign out when you leave the building after today's meeting if you've signed in. Obviously this is being live streamed. I think everyone here knows the score with that, and we haven't got anyone in the public gallery today. So just remind everyone to use the microphones provided when they are speaking. If I can just go round quickly, just for the record of people watching, if we can just get introductions. So, start with you, Andy.
Andy Biddle, Assistant Director, Adult Social Care, Portsmouth City Council.
Jane Didino, Local Democracy Officer.
Councillor George Fielding.
And we have Fiona from the News at the back there. So I'm just going to go through the first couple of bits, and then we've got a video to watch today, so which regards to item 3. So do we have any apologies for absence? Okay, thank you very much. And Jules, do you have any declaration of interest in this tool? Thank you very much. Okay, so we're on to item 3, which is the Adult Social Care Conference December 2018 for information only reports. This was a conference we had as an initiative to bring together people from different parts of social care in the city, and we took a nice video, so I think we're going to watch that first and then we'll get to Andy to introduce the report.
I hope that 2019 means that we actually do deliver what we're setting out to deliver. I think I've worked in social care for a long time, and we often have good ideas and then something happens and we don't actually deliver on them. So I really want 2019 to be a year that we can have in stone that says this is the year we really achieved and made a great difference.
I hope that we can get an even better social care system. We have some people who work incredibly hard, that they do a really good job, but that we can get to a position whereby our providers are working in the best possible way, but also, most importantly, that our people who use our services in adult social care are going to have a better outcomes, better quality of life, better well-being, and that is going to make their lives so much better.
Strategy has come about because we've been looking over the last 6 to 8 months about what we've been doing traditionally, and in order to make sure that what we deliver going forward is fit for purpose into the future.
Getting everyone together and having that opportunity to really discuss what's really important within our strategy that we've got going forwards.
And so the question that we asked ourselves at that point was, do we have the right offer available to all of the citizens in the city?
For us as the administration of the council, it's really important for us to have as much engagement as we can.
I think this gives us a great opportunity to start challenging some of those traditional ways, and that's a key element around that.
One of those is to do with culture. It's about barriers between organisations. It's about having the feel of acting like one workforce.
We have expert groups, and it's not discounting them, but actually what about the real people?
Understanding how people out there in the community like to receive information, so being more flexible with how we get information out there.
loads of great ideas. Where do I start? I think the bit about putting people very much in the centre and going back to what it is we need to do at an individual level. I think there were some amazing ideas around technology and looking at what we need to do in a strategic way, as well as, again, focusing on the individual and not having a one-size-fits-all approach.
The idea of personalisation, but really meaning it rather than just saying the words, is at the heart of us trying to build teams around our patients.
We need to work very differently. We need to ensure that we can work within our financial envelope. But we also need to focus far more on outcomes for people and move away from what's become a traditional approach over the last 20 years or so.
I come from the clinical commissioning group, and we work very closely with adult social care. Having a strategy is key. It's our roadmap for the future, working together, so very important.
The major great idea is to include the person we're all looking after. We all talk about the person at the centre. Some of us apply it, some of us don't. We have days where we do and we don't. But to have services led by it and driven by it is a really big, new, brave step.
Everything from how we can develop the market, how we can use technology better, and ways that we can collaborate. Not just within the sector, but beyond as well.
Somebody used the expression about using the Portsmouth pound, which I thought was really important. So how we take all the resources we have collectively, not just social care, but the voluntary sector, independent resources, families, carers, and use them to best effect.
Oh, it's absolutely crucial. It's one of the statutory responsibilities of the local authority, and it's an area where we can't work on our own.
I particularly like the bits around market development. And the way we relate to providers particularly, and a much more of a partnership approach.
I have felt as though there's been, for the last 2, maybe 3 years, a bit of a dearth in understanding of where we should be going and what we should be doing, and creative, new, vibrant, community-led thinking is just so exciting, so exciting.
Okay. Yeah, so that was great. Ines, would you just like to introduce yourself?
Yes, and my apologies, councillors, for being slightly late. Ines Richards, I'm Chief of Health and Care, Portsmouth.
Thank you very much, Ines. And so after that wonderful video, Andy, if I can pass you over to you to present item 3.
Thank you. So the report that you've got sight of is a summary of the key outputs and messages that we gained from the conference, as you've seen in the video. This was the aim of the conference was to think about the social care agenda with as wide a group of participants as possible across the city, from all sectors, from private business sector in terms of care, from the health service, the voluntary sector, and anyone that has an interest really in adult social care within Portsmouth. You saw the part of the introduction to the day that was made through Angela and Matt, and we had an introduction to our strategy, the adult social care strategy that we briefed here before, for all of the participants, and then we split people up into tables to work with each other, people they'd not worked with before necessarily, or didn't work with regularly, and asked them a series of questions about the social care workforce and the broad social care workforce within the city, thinking about how we encourage innovation in the city, how we, as Tracy said there, spend the Portsmouth pound amongst ourselves, and how we create productive working relationships between ourselves that focus on outcomes for the people that we work with. We had very enthusiastic participation along the themes of workforce personalisation, market development and technology, from people with varied experience of each of those areas. And we then asked people to put up the most important things to them that had come out of the day, and those are included within the notes. There's quite a long appendix included in this presentation. But some of the output that came out was about ensuring that we value the workforce through career pathways. When we're talking about care in particular, there's an underdeveloped career pathway for people. It's often paid at national minimum wage, and we know from feedback from the sector that we need to think about how people are going to progress through their careers and making care an attractive career to come into. Developing a shared culture was mentioned in several of the themes in terms of working with all of the sectors in Portsmouth, which the conference started to do. Personalisation, thinking about workforce development, training, learning and development across Portsmouth, how we encourage that. We've already got some things that we do together as sectors and businesses, but we could do more. Thinking about how we engage with people that we're providing services for, that co-production, and how we encourage micro-enterprises as well, small, often ward-based enterprises that work with a minimum number of people, to think about personalised outcomes rather than necessarily things that we've provided in the past. When we're talking about market development, thinking about tendering processes and asking for feedback from providers who tendered into our tendering process, the council tendering process, and also thinking about joint commissioning and working actively with the voluntary and third sector. And we had some discussion then about the launch of the Hive, which has happened subsequent to that conference. And then finally, technology, talking about the potential for a whole range of technology, not to replace the care that people have, but to augment it and complement it and enable people to do more for themselves. At the moment, the traditional approach has very much been, if you have a care need, it's often delivered to you or with you, whereas actually there is technology now emerging that you can take control of how those needs are managed for you. We ended that with the video of the day and Councillor Millington closing the conference. And that's the information report. The appendix there goes through each of the tables and a wider account than I've given you this morning of all of the issues that were discussed on the tables. I think the feedback from the event was very positive from all that attended, and you saw some of those box on the video. And we've since subsequently had a meeting with providers in the city. We're doing some engagement work with some of the voluntary sector providers in the city, and we continue to advance the agenda of joint working between ourselves and the NHS, which you'll be familiar with. And that's the report.
Thank you very much, Andy. I'll come to you in a moment, Ines, if I may. But George, did you have any comments, questions at all? Okay, brilliant. Ines, just thinking about the report and what the next stages are. So we've heard about the providers. What else has come out in terms of next stages in terms of out of the conference?
Yes, thank you. So there's a lot of work going on. So you will be aware that internally within adult social services, we've configured the teams and the leadership of those teams along each of the themes of this strategy. So we've got dedicated people in adult services who will lead on that for adult services. Every single theme on there involves working with other partners in the city. So part of their leadership job is to do that work in partnership as well. So we're really lined up around the strategy on that, which is an excellent thing. And we're making progress in most of those areas. There's a couple of areas, you won't be surprised that I say this, that I think could do with more attention as a city, not just as adult social care. I'm really struck by the feedback on the workforce sections here and the strength of feeling around, it's wrapped up in phrases like single workforce for the city, career pathways, and that one at the bottom with the most dots, I think it is, developing a shared culture. We're in this together. I think I haven't got a solution today, but I am aware we've got 2 or 3 work streams going on in the city labelled workforce. I think we could start to bring some of those together. So adult social care, talking about a workforce strategy, the NHS looks at workforce development, etc., etc. There's more we could do to bring those together. And the second area is, along a similar vein, is technology. I think by our own admission, we've not monopolise the benefits or the opportunities technology could offer to individuals, but also to our staff. We're making great strides in some areas. I say that in the week that adult social care has just gone over to System 1, which is the same sister care record system as health partners in the city are now using as well. But there's more we could do, and similar to workforce, I think there's benefit we could do to start joining those up. So I haven't got solutions to those two, but I'm flagging those as areas where we could do more join up in the city, and there will be people who are far greater experts than us, with due respect, on those subject areas. So I would say from a city council perspective, lending support to joining up those areas of work would be a good thing to do.
Okay, thank you, Ines. And just back to you, Andy, just for those people who might be looking at the report and we have lots of dots, can you just explain what happened there?
Yeah, people were asked to rank the most important things in terms of the colour of dots. The red dots were the things that people most valued, that they felt should be priorities that we were working on, and then that went down through the I think it was the yellow dots, and then the orange dots, and then the blue dots to memory, and then the green dots at the end. So those particular points with a lot of red dots alongside them, that was a shared perspective by a lot of people. I think it's important for that.
Thank you very much. George, did you have anything further? Just anything that's come out of what Ines or Andy has said at all?
No, I just think it's encouraging that obviously we're taking the information that's come from this event and helping to focus on key areas, which is ideally what we should be doing. So, no, congratulations and keep going.
Thank you, George. And I'd just like to say, I mean, this was this came up in the early days of Lib Dem administration. We had lots of conversations. We thought it would be really useful to have this kind of conference. And I was particularly grateful that we got so many people there from all sectors around the city, and I pay tribute to the team members who put that together and got the people there. I'd also like to thank the fact that Julie came along for Labour, and also Luke from the Conservatives. It was always key for us. This is a cross-party thing, because this is something that we all have to be bought into, and I thought the way that they interacted with the tables they were on and the people in the room was really helpful. That showed that it was just a really positive vibe. I remember saying after talking to I think it was Angela afterwards, and she said you can feel the buzz. The buzz is still going on. People were talking and getting on with talking about things even after it finished, rather than just going off and thinking, oh well, that was that. I'm also really encouraged by the what we've done since then, and thank you, Ines, for the input there. But also really looking at this becoming an annual event, and really feeding back on and having ways to feed back on what we've done, because just having it as a one-off and then leaving it is I think not the way forward. And I thought, like with Ines, I thought some of the feedback was very, very interesting, especially in terms of the ones that had lots of red dots, and the workforce development one, and I'd just like to expand a bit more on that. Obviously it's not just NHS and ourselves in adult social care, but this goes right across what we're doing in the city. Key worker housing, what is key worker? In some places it's very narrow, in other places it's very broad, and we need to make sure we've got that opportunity to develop our people in the care sector, because they are so valuable to us, everyone who works in that sector, and if we didn't have them we'd be really struggling. So to make sure we're valuing them as well in terms of their progression is really important. So thank you very much on that one. Happy to note the reports, and also I must say very much thank to the team who made the video, which I think is absolutely fantastic and really captured what came from the day, which was, again, as I say, a really positive vibe. Okay, so if you move on to item 4, update on the winter pressure funding for 2018-19, and back to Andy again. Thank you.
Thank you. This is the second information report for noting today. So this relates to funding that was agreed to run to the back end of last calendar year into the end of this month, to end the financial year this year. It's related to winter pressures. We've probably all fairly familiar with the term winter pressures that we've heard over previous years. The birth of this really was to manage some of the pressures that have been experienced in the system last winter previous to this. Where we'd seen high use of PHT, we'd seen difficulties with discharging people in terms of people moving on and going to the right destination and receiving the right level of care. We'd seen some real issues with capacity in the care system in terms of domiciliary care provided to people in their own homes. And increased risk to people in staying in a hospital environment when they didn't need to. Obviously there's a lot of sickness and illness around in hospital environments, and we want to get people out as soon as humanly possible. So the system, which is in this instance is constituted by the NHS and adult social care, both in Portsmouth and in the wider Hampshire region, agreed a winter plan based on some financial investment and some better use of existing resources to try and make an impact on this winter and mitigate against some of the issues that we saw the previous winter. There's various tables in there that show the up and down of, among other things, the MFFD, medically fit for discharge list. MFFD is constituted when somebody no longer needs that acute care within a hospital environment. So they then migrate to that list. And the people working in the hospital, local authority and NHS colleagues focus on discharging people out of the hospital as soon as possible after that point. In the background to the report, there is the amounts of money that were invested in the system, and particularly split out the PCC funding element, which was just under £600,000. This was to provide greater domiciliary care availability in Portsmouth, but also to provide for the management of that domiciliary care availability. So we contracted with a specific organisation that has a proven track record in recruiting carers for areas, and we also boosted the capacity in the Portsmouth reablement team, PRRT, to manage that care and to ensure that people move through the system as they needed to and on to final destination, wherever that was. What we found, the results of that funding, is that we haven't met the initial targets that were laid out. There was a piece of work done by PwC Consulting who gave us an idea as a system, including Hampshire, as the number we needed to reduce down bed days for people within QA over this winter. And the money didn't hit that target. But what the last table shows, I think it's table 5, is that if we hadn't had that investment in the system, it would have been an even worse winter than the previous one. So I think it's fair to say it's a mixed picture. We've seen a greater level of need of people presenting at the hospital, a greater acuity as it's termed. And because we had that extra investment within the system, we were able to continue taking people out in a more timely way, and that enabled the hospital to cope in a better way. We have hit those targets that we were given at various times during the winter, but it's not been a consistent picture, so it would be wrong to say that that's been consistently achieved. And table 4 shows the number of days lost after someone being declared medically fit for discharge decreasing, which sort of supports the picture in table 5 really, so that people aren't staying in the hospital for as long when they've been declared medically fit for discharge. So I think by those two criteria we'd see it as a successful investment. But obviously, if you went purely by the numbers, there'd be a question as to whether they've been achieved. This conversation continues really in the wider system now, because we're coming to the end of March, and that's when the extra investment ceases. So we're engaged currently in a conversation between ourselves and our health colleagues around funding, continuing to fund some of that additional investment, and looking to the resources that have been allocated from government for winter pressures this year, been headlined, to try and sustain that while we put Well, we put greater emphasis on admission avoidance at the front door, if you like. So thinking about how we work with people in the community, and if at all possible, to stop them getting to QA unless they need to. So providing that care and support there and then in a very timely way. That involves, of course, working with our colleagues in the Ambulance Trust and SCAS, because they have to feel confident that there's a backup if they're thinking they're not going to convey somebody. As a point of interest, we've seen some recent successes with our colleagues in Hampshire County Council working with a social worker in the SCAS control room, and being live on the radio to the paramedics and telling them what's available and what's going into someone. And we're in discussion with Hampshire now about how we can evaluate that and whether we want to think about that as well. So that's just a sort of example of what we're thinking about in terms of admission avoidance. Also within Portsmouth City Council, we're growing a reablement resource that we hope will complement that, will provide a very timely response to people when they're in need and help with that admission prevention and keeping people as independent as possible. So those are a couple of things that we're looking at. We've also got some schemes running that have been running for some time through Solent NHS Trust, working with care homes, with nursing homes in particular, to understand how we skill staff up so that people don't go to hospital unnecessarily. If you've got a great many care needs, there's got to be a debate and discussion about what the hospital can achieve for you, or whether we can achieve things for you if you stay in that environment rather than go to hospital. So those are a few examples of. We're looking to have a shorter term picture by the discussions we're involved in at the moment for this year, this calendar year coming, this financial year coming, sorry, and then thinking about how we then replace those resources with something more permanent that acts on the other end of the system in terms of making sure that people get the care and support they need in their own homes. And that's the summary of the report.
Thank you, Andy. George, did you have any questions or comments?
Not specifically. I mean, obviously, given the picture up until beginning of March on the numbers that we've got here, so obviously we're going to be continuing to monitor that going forward. It'd be interesting to see what happens, obviously, in terms of the funding, and whether we do have the additional funding to continue on how we're doing. So I think it's just something we're going to have to watch quite closely. Yeah, that's my only sort of a real observation. Thank you.
Is there any particular is there any particular lessons that you think we've learnt from we've learnt from the report, the results this year compared to last year, and that we might need, that we can take forward to next year as well?
I think what we've seen is the resource in the main was the right one. Domiciliary care was the right area to focus on, both from the perspective of making sure that people can go back home when they're able to, and not go into an institutional environment which isn't appropriate for them. Because I mean, when people come out of hospital, they're often not at their best. They're often going to recover some ability, and if they go into institutional care at the moment, there's a higher chance that they'll stay there. So I think it was the right resource to focus on. I think what it's shown us is it wasn't the full picture, because we've still experienced challenges, because we've still experienced high numbers of people medically fit for discharge in the hospital. Whilst we've reduced those days down, there's something else around thinking about the model that we may need for a smaller number of people. I think domiciliary care has been the right model for the vast majority of people, but we've seen some issues around whether we could do with a different type of bedded unit, maybe using the inpatient beds that we've got differently. Portsmouth City Council has reablement inpatient beds, and Solent NHS Trust equally has inpatient beds, and we're working with Solent at the moment to consider what model we think we're going to see. So I think those are two of the very clear lessons we've learned.
Thank you. Welcome, Luke. Do you have any interest to declare?
No interest. Apologies, I was late. The crime scene tape, I mean, I had to go the long way around the entrance.
Okay. So we're just on report number 2, so item 4 about the winter pressures. Did you have any comments, questions, anything like that? Okay, thank you. So Would you just be able to expand a bit more on the process we're going through at the moment in terms of what we're going to, about possibly extending this funding and how that's going to work?
So we've had a discussion as a system, that's both Portsmouth and South East Hampshire, around the elements of the extra funding that we'll put in place that we'd like to maintain, that we think worked and are worth doing, and some of those elements that we don't think proved themselves. Domiciliary care was one of those elements that proved itself. So we're now having a discussion about finances and the allocation of finance. Last year, for adult social care particularly, the government gave a one-off grant around winter pressures specifically, which we accessed and which we utilised. We've been told by letter that there's an intention to do exactly the same this financial year, but we haven't had that confirmed as to when that will be, how it will come, that kind of thing. So at the moment it's a finance-based discussion.
Okay, thank you. And again, I'd just like to... so there was one last thing. Just in terms of the impacts that we've seen in terms of in Portsmouth, obviously we've got these details. Have they had a similar result for Hampshire, just out of interest?
Hampshire's contribution to the fund was partly based on one of their own services, one of their own reablement services. And so, whilst there's been some extra domiciliary care from Hampshire's perspective, there's also been a growth in their service coming into the hospital, case finding and helping take people out. So we've seen the numbers are interesting, as you can see from the tables there. They split into the three. They split into Hampshire, Portsmouth and overall. And within Hampshire and Portsmouth, that'll be delays that may be attributable to social care or where someone may need continuing NHS care. So it gets even more complicated when you go to that sub-split. But we've seen a general downward trend in the number of days MFFD for both Hampshire and Portsmouth.
Yeah, which is very encouraging, because obviously, as I think we've said before at these meetings and whatever happens in Hampshire has an impact on our residents, because obviously it's about their access to the hospital as well. So it is important, but that's encouraging. Thank you very much for that. That's a really positive report. I think it shows that our investment worked. It was definitely worth doing and making best use of our precious funding as well. And obviously, it's really good to hear about thinking about some best practice as well, including the social worker in the control room for the ambulance service, which sounds a really interesting concept, which I'm sure can give a much better understanding for ambulance service. So certainly that's if that's something we can learn from, that would be really good. So I'm happy to note that report. There was just one thing. It said in the report about the video from the Adult Social Care Conference being available on the website. Is it available on the website yet?
I don't know is the honest answer to that, but I will find out.
That's great. So Luke, you missed the video where you were a starring role. So it was just saying it was a really good video, and obviously that will be there to share, and the really positive vibe from that conference. So thank you very much, everyone.